Hello, ladies and gentlemen. Today I would like to discuss with you the treatment methods of the ACL injury. But before I begin, let me tell you what the abbreviation ACL stands for. ACL stands for the anterior cruciate ligament. It is called the anterior ligament because there is another ligament beyond it called the posterior cruciate ligament. These two ligaments make a cross together, and that's why we call them a cruciate. They are both important for the overall kinematics and the stability of the knee. Furthermore, they can be completely or partially tiered. The tier in a ligament is graded from 1 to 3, and 3 being the severest and the most dangerous. Let's look at some x-rays. And here we can see that the doctor has to compare the intact knee with the injured one to grade the injury. To our right we see the intact ligament. You can see it as whole, and to our left we see it as a complete tear. And this is the grade 3 tear. Like I said, the injury is graded in 3 grades, and number 3 is the most serious. The grade 1 and grade 2 tears are partially tears, while the grade 3 is a complete tear. The complete tear always requires a surgical procedure. It cannot be fixed otherwise. There are both types of treatment approaches into this injury. The first treatment approach is the non-operative or the non-surgical approach. And this treatment is guided for those people who are less active and they are not into sports. The operative or surgical one that we can see on our right is actually the one pointed to the sports population. The aims of treatment. There are 4 main points of aims to treatment. First, regaining the full kinematics of the knee, reducing swelling and pain, regaining the normal joint movement, and strengthening all the muscles around the injured knee. The ACL ligament injury can be graded into 3 grades. These grades lead to the perspective of treatment. Different treatment methods are pointed to each individual population. It's either surgical or non-surgical. The non-operative treatment. It is generally indicated to the grade 2 or grade 1. It is for the population of the not so active. The main point here is that rehabilitation must be followed by exercise. To continue, the use of functional braces. This is really important, the non-operative. The patient can use functional braces, but he must understand the importance of them. They do not substitute the strengthening of the muscles. On the other hand, the operative approach is a surgical reconstruction. Usually it uses arthroscopic. As we can see in the picture, this doctor is using the arthroscope. If the ligament is unsuitable, like we cannot resuture it, then we can take a tendon from another place of the leg. Arthrosynthesis. What is arthrosynthesis? It is a clinical procedure where we use a syringe to remove the synovial fluid from the joint capsule. Why do we do it? To reduce swelling in the injured knee. Physical therapy. Physical therapy is the most important point in this session. Physical therapy is used in both types of treatment. Muscle re-education and stability exercises are our main highlight in here. They have to be performed under a physician's aid. They are used to strengthen all the muscles around the injured knee. Range of motion exercises are other types of exercise. They are used, like the name suggests, to regain full knee motion. Like any injury or any illness, home remedies are really important. You have to use the guided home remedies and not any remedy by anybody who told you. You can use crutches, ice bags, We can rest and elevate the leg, and of course pain relievers such as ibuprofen. The last type of therapy is the lifestyle changes. These are only used for people that undergo the non-operative procedures. The main point is just to avoid participating on sport and avoid applying pressure to the ACL ligament. In conclusion, the ACL is the anterior cruciate ligament. It is one of the two ligaments that stable and hold the knee together. It can be partially or completely torn. Two types of approaches are made into this injury after the diagnosis occurs. Physical therapy is needed for either type of approach. These are my references. Any questions? Yes, Abdullah?
So what's the ligament?
The ligament is a tough connective tissue that connects two bones together.
You said that the doctor compares the affected knee with the unaffected one. What if both were affected? What if both were injured? How would he know what grade this one?
Yeah, and here the doctor has to compare the injured knee with the intact one.
What if both were injured?
What if both were injured? Well, the mechanism of this injury to occur is for the femur to twist clockwise and the tibia to twist anti-clockwise, or the other way around. This maneuver is really hard to do. So if you do get this injury, it will reduce the risk of happening into the other leg, because you will not be capable of walking. Okay. If clinically this happened, it would be really rare, but if clinically it happened, I believe that the MRI will be sufficient enough to grade the injury.
Okay.
Anything else?
Okay, thank you.